Management Association, or HFMA, identified the need for improvement in the patient billing process after extensive research efforts focusing on both patients and providers. The HFMA's trademark phrase, patient-friendly billing, is based on the philosophy that all patient billing interactions should focus on serving the patient. In addition, the association encourages fair, honest, efficient, and privacy-respecting exchanges of information between all providers and insurers. The information found within the patient medical bill should be easy to understand and is subject to continued evaluation and improvement at the suggestion of those it serves. Finally, discussion of the financial obligations is discouraged during the medical visit. Based on the foundation that the needs of the healthcare consumer come first, the HFMA identified 4 functional goals to direct patient billing processes. Healthcare financial communication should be clear, that is, it is easy to understand. It should be concise, containing the right amount of information. It should be correct, and finally, should be patient-friendly, ensuring the needs of the patient and families remain paramount. In order for our healthcare system to truly serve its clients, an efficient and effective manner in which to do so must be explored. The finance industry must partner with its patients, providers, insurers, employers, and regulators in order to identify ways in which to better communicate with the patient it serves. This summary on the Patient-Friendly Billing Project will explore the consumerism and healthcare initiative of the Patient-Friendly Billing Project from 2006, the Reconstructing Hospital Pricing Systems report, as well as strategies for a high-performance revenue cycle report. An expansion of the financial management will be provided, along with the detailed application of the long-tail theory as it relates to patient-friendly billing.
According to the Healthcare Financial Management Association, there are significant problems with patient billing in this country. Providers and consumers alike all report through various studies that patient billing is confusing, they don't understand it, and even healthcare organization executives have reported that the patient billing system is too complicated to explain to the average patient. There are issues that need to be addressed, and this is the goal of the Healthcare Financial Management Association and other organizational entities that target the issues of patient billing. The Patient-Friendly Billing Initiative seeks to address the issues that are outlined. What can we describe that has contributed to this issue that is profoundly reported in patient billing? There have been major changes in Medicare and Medicaid. People are getting sicker, and there are also many people experiencing chronic health issues that require longer hospital stays and overall more interactions with not only physicians but other specialists. Some of those problems are that patients just don't understand their obligations regarding billing. They report that it's confusing, it's convoluted and opaque, and that they simply do not understand. Executives as well also report that some intricacies and details of the patient billing system is so complex that they also struggle with ways to communicate the obligations of the organization and the obligations of the patient to even the average patient. There are 3 main issues to this problem. The first is that patients are increasingly reporting that they don't understand their financial obligations when it comes to pricing and billing the healthcare. The second is that executives and healthcare organizations alike are reporting that the financial structure is too complex to come up with creative ways to effectively communicate those obligations to patients, as well as to inform them about the obligations and responsibilities that rest with the executives at the healthcare organization. The third piece to this puzzle is that healthcare organizations, hospitals, and others are reporting that due to the financial strain that they are experiencing as the economy changes, as changes happen with Medicare and Medicaid, that they are forced to make changes in their financial structures and often have to come up with complex formulas in order to address their economy within their hospital or within their organization. However, some have attributed these changes to the issues that we are seeing today. Hospitals are reporting that they are experiencing a rise in either underinsured or non-insured patients, and they are forced to come up with ways to make up for this lost capital. However, in creating these ways of addressing these complex issues of serving their community, serving the people that come to them for services, and yet working to establish a comparable level of capital so that the hospital can stay running and operational, these organizations find themselves working to address these financial issues. To further discuss consequences of these problems, issues with patient billing have been shown to influence the rise in underinsured or non-insured patients seeking out services from hospitals and other medical entities. Patient-friendly billing is the response to address these problems in order to make billing friendly for patients.
The first of the three reports from the Patient-Friendly Billing Project is titled Consumerism in Healthcare, an initiative of the Patient-Friendly Billing Project in 2006. The focus of this report is to improve the consumer's experience, to achieve price transparency, to utilize retail pricing approaches, and focus on training and development of staff. The entire consumer process revolves around the revenue cycle from the point of patient pre-registration through account settlement. Growth trends in healthcare insurance are toward high-deductible health plans and health savings accounts. This leaves many unanswered questions of how to fill the gaps experienced by hospitals, patients, and physicians. In addition to these concerns, providers and hospitals must adopt a different way of doing business. Consumerism in healthcare necessitates that healthcare financial services be more patient-focused with recruitment of all invested parties, consumers, providers, commercial and government payers, employers, and regulators. The Patient-Friendly Billing Project identifies 5 objectives in order to make consumerism in healthcare a positive force for all stakeholders. These strategies include price transparency, agreement on payment expectations and terms, simplified charge and payment structures, easy patient access and scheduling, and appropriate staff with requisite training and tools. The second report from the Patient-Friendly Billing Project is titled Reconstructing Hospital Pricing Systems, a call to action for hospital financial leaders in 2007. It focuses on guiding principles for a rational pricing system and steps towards a new pricing system. The current payment for healthcare service is complex, costly to administer, and almost impossible for the general public to understand. This inhibits public transparency, price comparisons, and trust in healthcare institutions. A rational pricing system should be simple to administer and communicate, be reliable as to cost and market price, create accountability to consumers, and allow for coverage of cost of care. Pricing reform is critical to transform what is confusing, opaque, secretive, and convoluted into something that allows consumers to think about what they are spending for care. The third report from the Patient-Friendly Billing Project is titled Strategies for a High-Performance Revenue Cycle in 2009. As healthcare expenses rise and payments are cut, a high-performance revenue cycle is essential for organizations to continue to meet their bottom line and patient community needs as well. The Patient-Friendly Billing Project recognizes this and offers strategies for a high-performance revenue cycle in relation to people, processes, technology, metrics, communication, and culture. The Patient-Friendly Billing Report emphasizes establishing high standards for hires. This begins at patient-visible revenue cycle positions and can reduce recruiting and training costs as it decreases turnover and patient dissatisfaction, while increasing morale. Second, processes were evaluated on improving the overall patient experience. Attending to the consumer included focuses on consumer-friendly billing. Improving the consumer's experience was most related to their understanding of payment obligations in the form of co-payments, deductibles, and co-insurance. Most important is an organization's culture, which is made of its shared values, attitudes, and goals. The Patient-Friendly Billing Report specifically endorses recognition of the revenue cycle at the executive level This involves recruiting non-financial staff, using patient services as a means for connecting employees with a sense of purpose, setting high expectations, celebrating success, and encouraging innovation. In summary, the patient-friendly billing report emphasizes that high performance doesn't just happen. Success extends beyond the business office to physicians, nurses, and staff. In addition to the following recommendations in this report, high performers are not always noted to have the latest technology nor to have the most desirable financial characteristics. They had the spirit of perseverance, recognize opportunities to put their goals into action, and to deliver value to their organizations, patients, and communities.
The business of healthcare is changing now faster than any other period in history. The federal government, insurers, and employers are changing the way they pay for healthcare, and in many circumstances, patients are being asked to pay more in the form of higher deductibles and copays. As we've addressed earlier in this project, patient billing is a significant problem. Consumers demand transparent and understandable billing statements. Consumerism in healthcare should be embraced, as patients' involvement in their medical care results in an improved overall health status, more conscious utilization decisions, and an overall reduction in cost. The Patient-Friendly Billing Project mainly aims at making patient financial communications clear, concise, and accurate through multiple initiatives producing reports including the consumerism in healthcare, reconstructing hospital pricing systems and strategies for a high-performing revenue cycle. The project attempts to provide a vision of a healthcare system that effectively utilizes health information management to ensure the highest value in clinical care, financial performance, and patient satisfaction. A vision where providers are focused on clinical care, insurers have timely access to information, claims are processed without rework, organizations with 0 days in accounts receivable, and patients are well informed and satisfied. Through all of these reports, the Patient-Friendly Billing Project identified key objectives and guidelines to assist healthcare organizations to achieve the vision. These guidelines include price transparency. Pricing reform is essential, and a new transparent pricing system should be meaningful, timely, and defensible. It should be fair to the consumers, particularly the self-paying ones, and easily accessible to patients online. Ideally, patients would be able to shop online for services, compare pricing and quality information on provider and hospital websites. Organizations should also aim to reduce the complexity of third-party payer contracts. Agreeable payment terms and expectations between providers and patients, where patients should be informed of their financial responsibilities prior to the provision of care. A payment request for their portion of charges should be made at the time of care. This includes access to an online patient portal where questions can be answered and bills paid. Restructuring hospital pricing systems, including simplifying the charges and payment structures, simplifying the hospital charge master, which currently contains thousands of terms and bills, renegotiating third-party payer contracts, and standardizing billing terms into an online glossary. Easy patient scheduling, establishing and maintaining customer service standards focused on creating a positive patient experience, utilizing EMR to provide access to patients to update their information, schedule appointments, test, and receive results. Monitor outcome measures related to the revenue cycle in terms of patient satisfaction, days in accounts receivable, cash flow, and debt. Organizations should prioritize the revenue cycle management. Financial leaders should engage the C-suite to hire and train adequate professionals and provide them with the necessary tools to ensure a streamlined revenue cycle. Standardized patient communication, possibly utilizing the Patient-Friendly Billing Project guidelines and the sample statements, bills, and letters provided to communicate effectively with patients. Coordination of information gathering between providers utilizing electronic health records increases the accuracy and avoids redundancy, thereby increasing efficiency and ultimately reducing costs of services provided. As the focus in healthcare shifts towards quality, executives should realize the correlation between the billing process and overall patient satisfaction. The philosophy of patient-friendly billing focuses on making patient communication clear, concise, and accurate, while utilizing technology to ensure safety, efficiency, and effectiveness of the process, and maintain privacy according to HIPAA guidelines. The development of a consumer-oriented, patient-friendly revenue cycle that is transparent, effective, and efficient is now a priority, and it requires involvement of consumers, employers, payers, providers, hospitals, and the government.
Hi, I'm Samantha Miller. For healthcare providers to stay in business, it is essential to be able to collect all the monies that are due to them. Good financial management requires doing what is best for your facility, but in healthcare, it also means doing what is fair and right for the patients. In Best Practices for Resolution of Medical Accounts, a report from the Medical Debt Collection Task Force, the authors recognize that most patients want to resolve their medical accounts in a responsible manner, but one of the challenges facing them is the highly variable process used to resolve accounts, which contributes to confusion. The Patient-Friendly Billing Project seeks to address issues across institutions to facilitate and suggest solutions for issues with the current billing process. The finance department of any healthcare organization develops the pricing structure of the institution, and it is with them that the solutions must begin. According to the Healthcare Financial Management Association, or HFMA, authors of the Patient-Friendly Billing Report, some common themes to be adopted by an organization include meaningful, timely, and relevant information on patient bills, defensibility, fairness to consumers, comparability of price and quality, ease and equity of administration, equity for providers, protection of community benefit activities, and efficiency. Hospitals that are high performers also focus improvement projects on the customer experience, which includes the billing process. These hospitals gather teams to address issues that are discovered within the billing process and also solicit input from consumers, in this case patients, regarding ideas for process improvements. The finance department also has the responsibility of looking at the pricing structure within the organization to determine where pricing can be adjusted, and also ensuring that all billable services are included on a bill. It is up to the financial leaders in the organization to push for the improvements that are needed to ensure that billing becomes more clear-cut for both the patient and organization to understand. Improvements can also be made within the IT department of an organization to purchase software or upgrade existing systems to allow the forward momentum towards true patient-friendly billing. Automated systems can decrease clerical errors within billing statements and verify diagnosis, insurance information, and possible eligibility for reduction of bills based on need. Some of the changes that were suggested by the HFMA for patient-friendly billing are actually required by the Patient Protection and Affordable Care Act of 2010, or the ACA. One of the new regulations in the ACA is the IRS 501R rule, requiring that patient education regarding financial assistance policies must be communicated verbally and in a written policy, and notices posted prominently in locations in the provider facility. Within the ACA itself, the law calls for organizations to provide timely billing and a transparent claims and denials management process. The ACA also requires clear and unambiguous descriptions of charges for which the patient is being billed. A fairly recent economic concept is the long-tail theory, which was first put forth by Chris Anderson in 2004. The long-tail theory states culture and economy is increasingly shifting away from a focus on a relatively small number of hits, which are the mainstream products and markets at the head of the demand curve, and toward a huge number of niches in the tail. Patient-friendly billing fits perfectly within the long-tail theory, as the current systems being used by providers would be examples of hits. Few products or processes being used by almost everyone. There are many opportunities to become part of the tail or niche group. With current technological advances, it is possible to design a billing process that best fits the community in which a healthcare organization resides. Computer systems can be used to improve front-end processes so that patients know what their cost is from the beginning of their visit, to determine eligibility for charitable care for low-income families, and simplifying the format of patient bills for easier comprehension. As far as the long-tail theory is concerned, the only obstacle to creating a niche product to suit the needs of an individual institution is imagination.
Patient-friendly billing initiatives will spark careful examination and innovation to provide high-quality patient care and efficient yet profitable fiscal practices. It was the Patient-Friendly Billing Project's vision to positively impact the quality of patient experience and excellent service coordination through the use of technology. While the idea of creating a system that supports clear, concise patient billing processes seems like a simple one, this requires a devoted, introspective, well-supported, and motivated group of stakeholders with a clear and global picture for the future. Maintaining the needs of the patient and families is paramount. The introduction of technology as a viable solution provides the most promising means of creating a standardized, streamlined, efficient system that provides clear and concise communication while eliminating duplications and avoiding error. Not only can the introduction of technology into the patient billing system promote stronger patient experiences, the fiscal success of the institution has the potential to be impacted for the better by being able to identify and monitor outcome measures related to the revenue cycle. Ultimately, the efficiency and accuracy of the billing process positively impacts the bottom line. In order for this to be successful, improvements must be acknowledged and made to the structure of the hospital payment systems. By applying the long-tail theory, financial departments can utilize technology to expand their options for creating better pricing structures. The finance department has the responsibility of reviewing the pricing structure within the organization to determine where pricing can be adjusted and to ensure all billable services are included. Benchmarking, experimentation, and imaginative thinking can lead to profound process improvements. As stated earlier, the future state of patient-friendly billing is promising as the healthcare system makes sure steps towards clarity and transparency in patient billing. Patient-friendly billing initiatives can and will spark careful examination and innovation to provide high-quality patient care and efficient yet profitable fiscal practice.